Welcome to the deep dive. Today, we're going to explore the healthcare system of Goa, India.
Goa.
Yeah. When you think Goa,
Beaches.
right, beaches, vacations, but
Right.
this tiny state has some of the best health outcomes in India.
It's true.
Really high life expectancy,
Yeah.
low infant mortality.
Very low.
So we're going to take a look at a bunch of research and reports and trying to figure out why their system is so successful.
Well, one of the most interesting things is that a lot of Goa's success in healthcare can be traced back to proactive government policies.
Okay.
Like they're not just reacting to problems, they're trying to get ahead of them.
So tell me more about these policies.
Well, for example, they have something called the Deen, Dayal, Swasthya, Seva Yojana, or DDSSY.
Okay.
It's a universal health insurance program
Wow.
that covers a significant portion of medical expenses for Goan families.
So, like, everybody's covered.
Yeah, in both public and private hospitals.
Huh. That's a huge difference from a lot of other places. But it can't just be about insurance, right? What about, like, the actual healthcare infrastructure,
Right.
especially in rural areas?
That's a great point. Goa has really invested in strengthening its healthcare network, especially in those rural communities.
Okay.
They've been upgrading primary health centers
Okay.
and community health centers
Sort of sense.
so that they can handle more cases locally.
So people don't have to travel as far.
Exactly. And they've also been integrating technology like better ambulance services
Oh, wow.
and telemedicine facilities for remote consultations.
It's amazing how they're using technology to kind of overcome those geographic limitations. I'm also curious about maternal and child health because that's a big indicator of overall health.
Sure.
What's their approach like there?
They're doing really well in that area.
Right.
They have programs like the Janani Surasha Yojana,
Okay.
which encourages institutional deliveries and even gives financial incentives to mothers who give birth in hospitals.
Wow.
That plus things like Mission Indrahana, which is focused on full immunization for children.
Gotcha.
Those have all helped to give Goa one of the lowest maternal and infant mortality rates in the country.
That's incredible. It sounds like they've built a really strong foundation.
They have.
But even with all that good stuff, there must be challenges, right?
Oh, of course.
Our research mentions something about tourism putting a strain on the healthcare system.
Right.
How does that work?
Well, tourism is obviously great for the economy,
Yeah.
but it's also a big challenge for healthcare.
Because so many people are coming in and out.
Millions of tourists every year.
Right.
It just increases the demand for healthcare services
Makes sense.
and puts a strain on resources, especially during peak season.
So how do they handle all these tourists needing medical attention?
They've been working on it. They've expanded emergency medical services,
Okay.
especially in touristy areas like the coast.
Right.
They've also been raising awareness among tourists about health risks and preventative measures.
So trying to keep people healthy and informed.
Exactly. It's
Yeah.
a tough balancing act, though.
Yeah, you got to take care of visitors and residents.
Exactly.
We also read about something called a specialist drain.
Oh, yeah.
What is that exactly?
It's a big problem for a lot of places.
Okay.
Basically, it means there's a shortage of doctors in specialized fields.
Like what?
Cardiology, oncology, neurology, all the really critical specialties.
Oh, wow.
Doctors trained in Goa sometimes leave for better opportunities like higher salaries or more advanced facilities in bigger cities.
Or even other countries.
Or even other countries, yeah.
So they're training these doctors and then losing them?
Yeah, it's a huge challenge.
So what are they doing about it?
They're trying a few things like offering better salaries and incentives.
Okay.
They're also creating more opportunities for professional development and research within the state.
To make it more attractive to stay.
Exactly. Some people are even suggesting partnerships with institutions abroad to share knowledge and maybe even attract specialists back to Goa.
So it's a pretty complicated problem.
It is.
We've talked about the public sector, but what about private healthcare in Goa?
Oh, sure. Private healthcare caters to a different segment of the population.
Like people who can afford it.
Yeah, often people who can afford higher costs,
Okay.
or they have specific needs that the public system can't meet.
I see.
They offer more specialized treatments, more luxurious facilities, and shorter wait times.
Gotcha.
Medical tourism is also a big thing.
Right. I could see that.
People coming from all over the world for elective procedures, wellness treatments, alternative medicine options like Ayurveda and yoga.
So you have two systems running side by side.
Pretty much.
How does that impact things overall? Do they ever interact?
That's a good question. They do operate independently,
Yeah.
but there are some areas where they could collaborate.
Like what?
Well, one promising avenue is public-private partnerships,
Okay.
or PPPs.
PPPs.
Imagine private hospitals being part of the DDSSY insurance scheme.
So people with government insurance could go to private hospitals.
Exactly. It would give patients more choices and might even lower costs through competition.
Interesting. Any other possibilities with these partnerships?
Well, they could also be really helpful in developing specialized treatment centers.
Okay.
Things like cancer or heart disease require a lot of investment.
In technology and expertise.
Right.
Yeah.
So PPPs could bring together the private sector's money and the public sector's reach.
It seems like it could benefit everyone.
It could.
But are there downsides to these partnerships?
Well, yeah, there are some risks.
Like what?
We have to make sure everyone has equal access.
No matter their insurance.
Exactly. And there need to be clear regulations so that private interests don't take over.
And transparency is important.
Absolutely. To build trust and accountability.
It's a delicate balance.
It is. Finding the right way to use both sectors without leaving anyone behind.
Looking ahead, what do you see happening with Goa's healthcare system? Any trends we should be watching?
Goa has the potential to be a real leader in healthcare innovation.
I could see that.
It's small, and the population is pretty tech-savvy.
Yeah.
I think we'll see them using technology even more.
Like how?
Imagine personalized medicine based on your genes or AI diagnostic tools that can detect diseases earlier.
That sounds pretty futuristic.
It does.
But what about right now? What are the biggest challenges they need to address?
One of the most pressing is the need for more tertiary care hospitals within the state.
Because right now, patients have to travel to other states for specialized care.
Right, and that's a burden on everyone.
It sounds like building those facilities would be a massive undertaking.
It would.
Any other pressing issues?
Well, the rising rates of mental health issues and substance abuse, especially among young people, are concerning.
Yeah, that's a problem everywhere.
It is, and it needs a multi-pronged approach.
Like what?
We need more prevention programs in schools.
Okay.
We need to destigmatize mental health.
Make it easier to talk about.
Right, and we need more treatment options that are affordable and accessible.
It's about more than just treating physical problems. It's about the whole person.
Absolutely.
Their mental and emotional well-being, too.
Exactly.
We've covered a lot in this deep dive.
We have.
It's been fascinating to learn about Goa's healthcare system.
It's a fascinating system.
But before we move on, I'm curious about the role of traditional medicine.
Oh, sure.
Ayurveda and yoga are popular with tourists.
Yeah.
But do they have a place in the actual healthcare system?
That's a great question, and it deserves more attention.
Okay.
Ayurveda and yoga are definitely connected to wellness tourism.
Right.
But they also hold a deeper cultural significance for many Goans.
It's part of their heritage.
Exactly. It's woven into their daily lives and passed down through families.
Do you think these traditional practices could become more formally integrated into the healthcare system?
It's definitely possible.
Like how?
Imagine a system where patients could choose conventional medicine or traditional therapies,
Okay.
with practitioners from both sides working together.
That's an interesting idea.
It is, combining modern medicine with ancient wisdom.
But it seems like it would be tricky to integrate those approaches safely.
Oh, absolutely.
You'd have to be really careful.
Definitely. We need rigorous research, standardized training for practitioners,
Right,
and ethical guidelines.
to make sure everything's done responsibly.
Exactly.
It's a complicated issue
It is.
with no easy answers,
Not at all.
but it's a conversation worth having.
Definitely not just in Goa, but everywhere.
It's a reminder that innovation can come from anywhere,
It can.
and that sometimes the best solutions come from combining different approaches.
I agree.
I think this is a good place to pause and let our listeners absorb all this information.
So good.
We'll be back soon with the final part of our deep dive into Goa's healthcare system.
Looking forward to it. Welcome back to our deep dive into Goa's healthcare system.
It's been fascinating so far. We've talked about government initiatives, infrastructure challenges, the impact of tourism, the struggle to retain specialist doctors. But now I'm wondering about something we haven't really touched on yet. The economic side of things.
Okay.
Is healthcare actually affordable for the average person in Goa?
That's a really good question, and the answer is a little complicated. You have to think about both the costs of care and people's ability to pay.
Right.
So on one hand, the DDSSY Goa's Universal Health Insurance Program, it provides a safety net for a lot of people by covering a big chunk of their medical expenses.
Okay.
But there are still out-of-pocket expenses for things that aren't fully covered.
Like what?
Certain medications or specialized treatments. And for people who rely mostly on the public healthcare system, those extra costs can be tough.
So even with insurance, it's still a balancing act for families.
It is.
What about the private sector? What kind of economic challenges do they face?
Private hospitals in Goa face a different set of pressures. One of the biggest is the high cost of land and infrastructure, especially in urban areas.
That makes sense.
That can make it hard for them to expand and offer more services, especially in rural communities where access to healthcare is already limited.
So it's like a geographical constraint on their growth.
It is.
We talked about the specialist drain earlier. I imagine that economics plays a role there too.
Definitely. Private hospitals often have trouble competing with the salaries and benefits offered in bigger cities.
Yeah, or even other countries.
Right. It's a global competition for talent.
It is. So healthcare isn't just a local issue.
It's not at all.
It's tied to these bigger global trends and economic forces.
Absolutely.
We talked before about public-private partnerships as a potential solution. Could those partnerships help address some of these economic challenges?
I think it could. PPPs have a lot of promise, especially in a place like Goa. Imagine if private hospitals were more involved in the DDSSY scheme.
Okay.
That would give patients more choices and could potentially bring costs down.
Through competition. So you're using the strengths of both sectors to make healthcare more accessible.
Exactly, and hopefully more affordable.
What other possibilities do you see for these partnerships?
Well, another area where PPPs could have a big impact is in developing specialized treatment centers.
Dope.
Things like cancer or heart disease, they often require major investments.
The technology and expertise.
Exactly. So PPPs could help by combining the private sector's financial resources with the public sector's reach and oversight.
It sounds like a win-win.
Could be.
But with any complex system, there are always potential downsides.
Ooh.
What are some of the risks with these public-private partnerships?
That's a good point. While PPPs have a lot of potential, there are definitely risks to consider.
Like what?
Well, for example, we need to make sure everyone has equitable access to care.
Regardless of their insurance.
Right. And we need clear regulations and oversight to prevent private interests from taking priority over public health goals.
That makes sense.
And transparency in pricing and service delivery is crucial to build trust and accountability.
It's a balancing act, finding a way to get the benefits of both sectors while protecting patients.
It is.
Looking ahead, where do you see Goa's healthcare system heading? What are some of the key trends you're watching?
I think Goa has the potential to be a real innovator in healthcare delivery, especially because it's relatively small and has a tech-savvy population.
So they're well positioned to try new things.
They are. I think we'll see them continue to focus on using technology.
Like what specifically?
Well, imagine personalized medicine based on your genetic profile.
Wow.
Or AI-powered diagnostic tools that can detect diseases much earlier and more accurately.
That sounds incredible.
It does. But let's not get ahead of ourselves. What about the more immediate challenges?
Okay.
What are some of the pressing issues that need attention right now?
Good question.
One of the most critical is the need for more tertiary care facilities within the state.
Because right now, people often have to travel to other states for those specialized procedures.
Exactly, and that's a huge burden.
Yeah, it sounds like building those facilities would be a massive undertaking.
It would be.
Any other areas that you see as particularly important?
Well, the rising rates of mental health issues and substance abuse, especially among young people, is a major concern.
It is. It seems like that's an issue everywhere.
It is. And addressing it requires a multifaceted approach.
Like what?
Well, we need more robust prevention programs in schools and communities.
Okay.
We need to destigmatize mental health issues and encourage people to seek help.
Right. Make it okay to talk about it.
Exactly. And we need to make treatment options more accessible and affordable.
It's a reminder that healthcare isn't just about treating physical ailments.
It's not.
It's about taking care of the whole person.
Absolutely.
We've covered a lot of ground in this deep dive, exploring the intricacies of Goa's healthcare system.
We have.
But before we move on, I'm curious about something we touched on earlier, the role of traditional medicine.
Okay.
We know Ayurveda and yoga are popular with tourists, but do they have a place within the mainstream healthcare system?
That's a fascinating question and one that deserves further exploration.
For sure.
While Ayurveda and yoga are often associated with wellness tourism, they also have a deeper cultural significance for many Goans.
It's part of their heritage.
Exactly. These practices are often integrated into their daily lives and passed down through generations.
So it's not just a trend, it's part of their way of life.
It is.
Do you see any potential for integrating these traditional practices more formally into the healthcare system?
It's certainly a possibility worth considering.
Okay, how would that work?
Imagine a system where patients have access to both conventional medicine and traditional therapies.
Okay.
with practitioners from both disciplines working together to create personalized treatment plans.
So it's about combining ancient wisdom with modern medical science?
Exactly.
But I imagine there would be challenges in integrating these approaches effectively and safely.
Oh, absolutely. It would require careful consideration to ensure the safety and efficacy of traditional practices.
Well, of course.
We need rigorous research, standardized training for practitioners, and clear guidelines for ethical and responsible integration.
It's a complex issue with no easy answers.
It is.
But it's definitely a conversation worth having.
It is.
Not just in Goa, but in healthcare systems around the world.
I agree. It's a reminder that innovation can come from unexpected places.
Right.
And that sometimes the most effective solutions lie in bridging seemingly different approaches.
Well said. It seems like we've reached a natural point to pause and let our listeners absorb all this information.
Sounds good.
We'll be back soon with the final part of our deep dive, where we'll wrap up our exploration of Goa's healthcare system.
I'm looking forward to it.
Welcome back to our final segment on Goa's healthcare system.
It's been a fascinating journey exploring all the complexities and innovations of this really unique system.
It really has. We've covered so much ground, from government programs and infrastructure to economics and public-private partnerships. But in this last part, I want to bring it back to the individual. What does all of this mean for the average person in Goa? How do these policies and trends actually play out in real life?
That's a really important question. Ultimately, the success of a healthcare system is measured by how it impacts people's lives.
Right.
For the average Goan, it's about access, affordability, and the quality of care. The DDSSY, their universal health insurance, has been a huge step forward.
Yeah.
It's given a lot of people financial protection and access to essential services. But there's definitely more work to do, especially when it comes to equitable access to specialized care and dealing with rising treatment costs.
You mentioned equity a few times. Can you talk a bit more about what you mean by that? What are some of the barriers that prevent people from getting the care they need?
Well, equity in healthcare means that everyone has a fair chance to be as healthy as possible. It's about recognizing that different people face different challenges and making sure that healthcare services meet those needs.
Makes sense.
So, for example, people in remote rural areas might struggle with getting to healthcare facilities.
Because of transportation or distance?
Exactly. Or maybe they don't have specialized facilities nearby.
Right.
People from lower socioeconomic backgrounds often struggle with out-of-pocket costs, even if they have insurance.
That makes sense.
And then things like cultural beliefs or language differences can make it hard to communicate with healthcare providers.
So there are a lot of factors at play.
There are.
It's not just about having hospitals and doctors. It's about addressing all these other things that impact people's health.
It's about the social determinants of health.
Exactly. What can be done to address those disparities and make healthcare more equitable for all Goans?
Well, it takes a multi-pronged approach. We need to make sure that primary healthcare infrastructure in rural areas is strong. We need to expand telemedicine services so that people in remote areas can connect with specialists.
Right.
And of course, we need to keep raising awareness about health issues, prevention, and the resources that are available.
So empowering people to take charge of their own health.
Exactly.
We've talked a lot about the challenges, but what are some of the things that Goa is doing well when it comes to healthcare? What can other regions learn from their example?
One of Goa's biggest strengths is its proactive approach to public health.
Okay.
They've implemented programs that target key areas like maternal and child health immunization and disease prevention.
So they're really focused on prevention.
They are. And that not only improves health outcomes, but it also reduces the burden on the healthcare system down the line.
Right.
They've also been really innovative in using technology to reach more people, especially through telemedicine.
It seems like they understand that technology can be a powerful tool for making healthcare more accessible.
It can.
As we wrap up our deep dive, I want to touch on something we talked about earlier, the potential of incorporating traditional medicine into the mainstream healthcare system. What are your final thoughts on that?
It's a really interesting idea with both potential benefits and challenges.
Yeah.
On the one hand, practices like Ayurveda and yoga are so deeply rooted in Goan culture, and they offer a holistic view of health and well-being.
Okay.
Integrating those practices could give patients more options and potentially make healthcare more effective overall.
Right.
But it's super important to approach this carefully. We need to make sure that traditional practices are safe and effective.
Right.
So we need rigorous scientific validation, standardized training for practitioners, and ethical guidelines.
So finding that sweet spot between respecting traditional knowledge and ensuring patient safety.
Exactly.
Yeah.
And that's a conversation that needs to involve everyone, healthcare providers, the community policymakers, and researchers.
A collaborative effort.
It is.
So as we conclude our deep dive into GOA's healthcare system, what are the key takeaways you'd like to leave our listeners with?
Well, GOA's journey offers some valuable insights for healthcare systems all over the world.
Okay.
It shows the importance of addressing not just medical needs, but also the social factors that influence health.
Those social determinants of health.
Right.
It shows how powerful proactive public health initiatives can be, especially when it comes to prevention.
Exactly.
And it highlights how technology can help to bridge gaps and reach more people.
Well, it's all about finding solutions that work for that specific community while always putting the individual's well-being first.
Well said. It's been a pleasure exploring this with you.
Likewise.
And to our listeners, we hope this deep dive has sparked your curiosity about healthcare systems around the world.
Keep asking questions and stay informed.
Advocate for a future where everyone has access to good, quality, affordable healthcare. Thanks for joining us.